Hello everyone, today's video is about the clinical effects of neurofeedback that I've been seeing in my practice for the last little while. I've been using neurofeedback for about a year and a half now. We've done a few thousand treatments, several hundred brain maps, and just wanted to share some of the clinical experiences and effects and things like that that I've been seeing. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if you don't mind taking a moment at some point during the video or at any future junction to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So with neurofeedback, what I've been finding is that for some conditions, it's been very reliably helpful. Other conditions, it's been less reliably helpful. So I just kind of wanted to just do a little update video in terms of what I've been seeing in practice. For reference, if you're watching this and you don't know what neurofeedback is, good for you for watching a video about something that you don't know about. So always good to learn new things. I'm learning new things all the time. I do have a 50-minute podcast episode all about brain mapping and neurofeedback. So if you keyword search my name on my YouTube channel, along with the term neurofeedback, you'll find that video. So a really nice deep dive into what neurofeedback is all about. And then you can also look at other resources on the internet if you're not sure what that is. But the short explanation is it's a non-invasive method of helping to retrain the brainwaves of our brains, and with the intention of helping to alleviate certain symptoms or health issues that might be related to those abnormal brainwave patterns, like insomnia, anxiety, depression, sometimes chronic pain issues, fatigue issues, different things like that. So a lot of different applications for neurofeedback. What I've been finding to be the most consistently or symptoms or conditions that I've seen to most consistently benefit from neurofeedback have definitely been things around kind of the mnemonic that I use is anything where the nervous system is kind of like revved up or kind of like overstimulated, kind of discombobulated in some way. So that would be conditions like anxiety, conditions like OCD, insomnia, just kind of feeling like scattered, feeling kind of frazzled. Those would be the most it's quite, in my experience to date, it's quite uncommon to not see improvements in those symptoms when we're working with neurofeedback on an appropriate extent. What I mean by that is, doing enough treatments to see a benefit. Now, the number of treatments can really vary from patient to patient. Sometimes we're seeing significant gains within the first few treatments. Sometimes it's not until we hit like the 10th treatment. It really depends. Doing a brain map ahead of time it is very helpful, because then we can get a better sense of the magnitude of the problem that's there in the first place, and knowing exactly where to put the sensors, exactly which programs to work with. So that helps us to figure out kind of prognostically like how many treatments might we need and whatnot. But it's that part of it's not an exact science. It's really about we start the neurofeedback and see how it goes. Sometimes we have to tweak the protocols a little bit to get those results. So there's some fine tuning that goes into it sometimes. But I found that those conditions are most reliably responding to neurofeedback. So folks, most common things that they're telling me when they come in after, to visit with, like have a follow-up with me after they've done some sessions, is saying like, I feel more centered, I feel more resilient, I feel like my nervous system can handle more stuff, my mood is better, I feel less stressed out about things, I'm not feeling as anxious about things, I'm not worrying as much, my sleep is deeper, and those are the most common things that I'm hearing. Now, I guess maybe we could lump kind of like lower mood and depression into the mix as well. What I've also been seeing quite consistent benefit, or what's also been quite consistently benefiting from using neurofeedback, are cases where patients are presenting with symptoms related to ADHD and also individuals on the autism spectrum. Now, ADHD and ASD, autism spectrum, those are types of neurodivergence, so they're not pathological in and of themselves, but some folks with those neurodivergent characteristics have symptoms or have features of those expressions of neurodivergence that interfere or get in the way of their living happy, productive lives. If someone has an ADHD brain and they're a kid and they just can't sit still in school, and it's like, well, it's either, we do something about this, or you're going on medication, or you're going to have to be homeschooled, and that's not what the parents want, or whatever it happens to be, then Neurofeedback can be really helpful for helping with that focus, helping with that attention, that type of thing. Or some of the kids we worked with on the autism spectrum, they say there's more like if they've had more like combative behavior, or they've been having communication challenges. We've been seeing improvements in those types of aspects of their kind of clinical presentation. So those are a couple of other sort of subsets of patients who've been quite consistently benefiting from neurofeedback. What I haven't seen as much change with as I was hoping to see, and the reason I was hoping to see this is because there are case reports, research studies showing that there is benefit from neurofeedback for these conditions, and I have seen benefit in this regard, but just not as much as I was hoping to see. And that's with conditions like chronic pain. So whether that's musculoskeletal pain, like fibromyalgia related pain, or like pain that's sometimes associated with like chronic fatigue syndrome, kind of just like this like heaviness, this kind of post-exertional malaise. I haven't seen the needle move on that symptom very quickly at all. And I'm a little bit impatient. So if we're not seeing a change within like maybe 10 to 15 treatments, it's like like this. We're usually switching gears to something else by that point. So maybe I'm not giving it enough time, potentially. But anyways, that's something I haven't seen any quick changes with to date, with a couple of exceptions. That pain category would also apply to chronic migraines as well. Now I have one patient or a couple of patients actually, who have been noticing improvements with their migraine and headache frequency, and there have been some changes there, but just hasn't been like knocking it out of the park, like curative, in a timely fashion with those cases. So that's been a little bit disappointing. Might just be the way that I'm using neurofeedback. There might be other practitioners out there seeing great results. So I'm still a learning journey, a learning process for me, but that's something that's been a little bit, not seeing the results that I was hoping to with those cases, and kind of the not as speedy as I was like to see. Over and above that, for other conditions that I haven't been seeing quick or notable changes with, I guess the other would be that this one's a little bit more of a mixed bag. So in some cases I've been seeing improvements here and some not. But with folks who have like a lot of sensitivities or reactions to things, so like whether it's reacting to foods, reacting to chemicals, reacting to environmental stimuli, patients who maybe have mast cell activation syndrome, we know that there can be a big, oftentimes there is a big nervous system regulation component that can underlie that, because stress hormones, certain other factors related to hypersensitivity can exacerbate, related to a stress response can exacerbate those types of conditions. So it makes a lot of sense to say, hey, let's settle the nervous system down. Maybe you're not going to react to things as much. And with some patients, that is proving out to be the case. But with some patients, they're coming back saying, I feel more centered, I feel more relaxed, I'm in a better mood, my sleep is better, whatever. But like, I'm still just as reactive to X, Y, or Z substance. So in those cases, it's been, a bit, has been disappointing, because we went into the neurofeedback thinking, this is what we're going to try to fix with this or improve with this. And, we saw some other benefits, but not what we were hoping to see. So that one's, a little bit disappointing for some of those cases where we haven't seen the needle move the way I was hoping it would. But there have been some cases where it has moved. So I think it's still a worthwhile thing to, consider for a case like that, but it hasn't been quite as consistently helpful as I was hoping it would be. I think those are the main categories that I wanted to speak to. If there's any conditions that you are wondering about, as in terms of like the applicability of neurofeedback, or maybe you're having neurofeedback or you had it done for X, Y, or Z condition, and you're wondering what my experience has been like with it, feel free to post in the comment section below. Or if you have used neurofeedback and it was helpful for you, not helpful for you, if you want to comment on that at all, please post in the comment section below. Be curious to read those comments. Otherwise, I will leave it there for now.